From Wana Brands, welcome to Enhance Your Life. I'm your host, Jonathan Small, and each week I talk to people from all sorts of professions and backgrounds about how cannabis has enhanced their lives and how this healing plant can enrich your life too. Hey everybody, welcome to the Enhance Your Life podcast. I'm your host, John Small, and it is a pleasure to have you with us today. My guest today is Elisabeth Mack, who founded Holistic Caring in 2016 to bridge the gap between conventional and cannabis medicine through education, guidance, supportive care for patients. And she offers product choices, dosages, interactions, and timing, and just good old-fashioned nurturing and caring. And Elisabeth is a provider for the California Board of Registered Nursing, and she's authored a curriculum to approach cannabis by emphasizing holistic and functional medicine. She is now training the entire audience of healthcare to become a cannabis health coach. We'll find out about that. And she's built training programs to prepare coaches for success in patient consultations and teaching industry staff and leading workshops. Elisabeth, thank you so much for joining the podcast.
Thank you, Jonathan, for the invitation. It's an honor to be here with you.
So talk to us about what the Holistic Caring Network is.
Well, Holistic Caring Network at a high level is an ecosystem. You know, when I got into the industry back in the beginning of 2015, I found out how to use cannabis for myself, and that bridged into, I've got to tell other people about this, and that bridged into everything else that came from that. But essentially connecting the products and the patients with programs and providers and all the process that is needed to steer the ship. So in other words, Holistic Caring Network is the ecosystem that allows providers to get trained in the process of how cannabis works and to get vetted products to patients through programs where they can optimize their care. We do a lot.
Yeah.
But, I really call it the ecosystem because I used to think holistic caring is counseling and case management for patients on how to use cannabis. But then I wrote a book and that book became my programs. And now we have a full educational platform to train cannabis industry professionals, healthcare professionals, and patients in many different things. And now we're also building a cannabis nurse approved or green nurse approved marketplace where the best vetted producers that would like us to take them to patients. We're connecting those dots as well. So really, it's an ecosystem of care.
You alluded to your own experience with cannabis. So let's step back for a moment. How did you first discover cannabis, or how did cannabis first discover you?
At the end of 2014, I had a bicycle crash and I went out on leave from my last corporate job, which was the regional sales manager for Anthem Blue Cross for the county of San Diego. I was running employee benefit programs and I had an accident and I needed surgery, and I went out on leave to have surgery. And about a week after that operation, I had a chiropractor appointment and she said, "Why don't you have my medical massage work out that shoulder?" And I said, "Okay." So the next day I went there and she was using CBD in the oil. And I said, "Hey, what is this? It smells funny." And she said, "It's cannabis." And I'm like, "Why are you putting cannabis on me?" And she goes, "It's going to help your endocannabinoid system and it's an anti-inflammatory that will help you get back to that pre-surgical arm faster." And I said, "Okay, sign me up and tell me more."
Yeah.
Next thing you know, I'm at the library checking out every book I could on cannabis and finding online journals. And I think I found Project CBD and ran into a bunch of PubMed articles. And I said, "Wow, this is really crazy because I've been in healthcare for 30 years and nobody ever told me about this."
They didn't tell you about this, and they probably had a negative take on it. What was your impression of cannabis before your accident?
Well, I had used it recreationally occasionally, but I'm always a nice wine drinker. But as far as a recreation, and so it was something that was really not in my life. And so I really came at it with a fresh set of eyes saying, if this is truly medicine, why aren't we talking about it? And is this really just an excuse for stoners? And I found out, no, it was something that really is therapeutic. And, even with just that topical, I bought one and I started to use it daily. And then the next thing you know, I'm interning with this woman and her boyfriend who had a dispensary back in the Prop 215 days. Then I got extended to a Medican clinic. Dr. Talleyrand was coming down once a month to write recommendations at a clinic that they were helping to manage. So I started to learn from him, and everything just snowballed. And I started to interact with the industry all of 2015 at this beginning of things here in San Diego. Women Grow was just forming.
Mm-hmm.
I started to attend Women Grow in January of 16.
Women Grow is an organization for female cannabis professionals?
Yeah, exactly. And so January of 16, I went to the national conference for Women Grow, and my eyes really got open where there's a couple hundred women in there that are wanting to participate. But what really came to me is that people are making medicines, people are selling medicines, but nobody's interpreting that for patients on how to really use them as medicine. And in conjunction with everything else that they're doing, looking at the other side of the treatment plan, what is conventional care doing for them, and what can cannabis do, and how do you interlace them? So that's what I found is that my unique value proposition in this industry is to do that, to connect the dots between conventional and cannabis therapeutics.
So who are your patients mostly that use your services? You mentioned before we started rolling tape that a lot of your patients are people that have tried a lot of, or either managing chronic pain, well, I'll let you explain it. You'd be much better explaining it than me.
Well, when we think about the patients that are scheduling through holistic caring, people find us through referrals, stage 4 cancer patients. So Heal Navigator sends us patients, and all of them are looking at oncology options, or they've already tried several of them. Many of them have had chemotherapy, radiation, surgery, etc., and they're fighting for their life. And they're like, how do I use cannabis oils? So that's one group of people we work with a lot. Another is folks with dementia and Parkinson's and aging issues. I've interacted with another organization called Positive Approach to Care with Tipa Snow. And this is all types of dementias. And when we're looking at seniors, think about people over 80 that have developed dementias. The next thing you know, they're on antidepressants, they're on benzodiazepines and sedatives and hypnotics, and then they get to antipsychotics to manage their behavior. Cannabis can be so much more of a better option for all of those drugs to be able to replace them. And, I have weaned people off of 5-6 pharmaceuticals in those situations and taking cannabis. And of course, patients with chronic pain. I have people that I'm going to have surgery and I don't want to take opiates. I took opiates last time and I don't want to take opiates this time. How do I do my surgery without them? Or I'm already on opiates. How do I start weaning off of them because it's destroying my life and I can't function anymore? So a lot of patients with chronic pain, and just it runs the gamut for all kinds of things. But one of the things I'm most excited about is the potential to really bring this into more purveys of medicine and start to look at metabolic syndrome and cardiovascular disease and diabetes and obesity and some of the issues that we can manage. But you have to couple cannabis with lifestyle medicine and functional medicine as well. It's not just pills. It's not just the cannabinoids. It's putting everything together so that patient can really optimize their life again. So really, what we do is conventional medicine with cannabis and teaching them how cannabis works as medicine, what the endocannabinoid system is, how we run deficient, and how you can supplement and bring yourself back to homeostasis, just like you would supplement with vitamin D, and then how to use the specific cannabinoids. Everybody talks about CBD and THC, but what about the minor cannabinoids? What about terpenes? What about the quality of the oils? How do you find medicine that's actually suitable for you that might even be symptom targeted? So we help them with all of those types of decision making and helping them really optimize that care.
And how does it work? Does each one of your patients have an individual guide that can answer their questions? Because cannabis is very personal, right? There's not one size fits all. And so you really need to have an individualized approach to it.
Yes, absolutely. And each person is different, right? So it's not just cannabis is different, but each person's different. And they're all coming to you on different assortments of pharmaceuticals already. And, they've tried all different kinds of things, and they've already done lifestyle modifications sometimes. And everybody's different, but our process, if you go to holisticcaring.com and you click on the patient services tab, there's a telehealth button that explains what our appointments are. And so we have either a full consultation or a mini consultation. And the mini consultation, it's really designed for people that are already using cannabinoids in some way, shape, or form. And they just need to really go over how to improve what they're taking and figure out the routes and the ratios and how to stack these products and break tolerance and that sort of thing. And then a full consultation, we explain to them after doing an assessment where we're getting their pharmaceuticals and their procedural history. Then we teach them about the endocannabinoid system, the cannabinoids, and the different routes of administration and basic dosing and titration schedules, and how to incorporate this into everything else that they're doing. And then that includes a tracking log and a primer. It's my ebook that shows them how to use everything. And then on follow-up calls, because that includes a couple of follow-up calls, we go through the tracking log and say 1 to 10, what are the changes that you've noticed in your pain, your anxiety, your memory, your focus, your mood, your energy levels, your sleep, blood pressure, blood sugar, some of those indications. And if we're working with cancer patients, what's coming up in the labs and the scans? Are we making progress or are we falling back? And that's what we do. It's really just clinical medicine.
Right. Do you find that your patients, often the families of patients will approach you, maybe because maybe people of a certain generation or a certain age are not comfortable with cannabis or just have not had a good experience in the past with it, but there's somebody in their family who is advocating for it and feels like it would be a lot better as medicine than some of the opioids or whatever medications they're taking, or it would help enhance or, be a good enhancement to whatever they're doing. Do you find that you have a lot of families reach out to you?
Absolutely. Especially when we're talking about dementia care, it's almost always the family or a daughter or a granddaughter or a wife, etc. But a lot of people have had this so stigmatized that, even if they're suffering with chronic pain or cancer, I've got people with stage 4 cancer saying, I don't want to take cannabis because I don't want to get addicted.
Mm. Yeah.
The prohibitionists for the past 100 years have really done a great job telling people not to use this drug no matter what. So now when their life depends upon it, they're still kicking and screaming all the way there. And it's nuts.
Yeah, it's quite sad. You mentioned cannabis and dementia. I'm curious, in your experience, what have been the effects of cannabis for people suffering from dementia? And again, it's different for each person, but what has been your overall experience and observations about that?
When we say dementia, that's an umbrella term to a lot of different things. But if we were to unpack that, what symptoms are they having? Really, it's managing anxiety and agitation, managing some of that incessant anxiety where people are constantly reaching out to their caregiver, their spouse, their whoever is with them, repeatedly asking the same question. They're anxious, sometimes other types of behaviors, and then sundowning. So late afternoon, people get really wound up and their circadian rhythms are completely flipped. What we want to do is manage the anxiety and then get them to have better sleep-wake cycles. And you do that through various terpenes and cannabinoids. If we're dealing with anxiety and agitation, CBD, little CBN. And then if we're trying to get people to sleep, THC, CBN, myrcene. And you can drive different symptom-targeted formulations for these different symptoms. For just cognitive enhancement, if you have a CBD, CBG, or some pinene and limonene, and that's my favorite go-to for morning blends, and we're dealing with several different symptoms. A lot of times you're dealing with somebody that stopped eating, and a good 1-to-1 is one of my workhorses, right?
Yeah.
That is something that we could do 5 milligrams 3 times a day and solve all kinds of things: anxiety, sleep, appetite, agitation, and get them to eat. And then over time, you could start weaning off the pharmaceuticals. And honestly, Jonathan, what happens is when people come to me, they're already on so many pharmaceuticals that the number one goal has to be to start reducing those drugs and the dosing, because when we start to do that, we A, start to see that real person come back, and B, the cannabinoids work better, right?
Yeah.
Because you don't have all the pharmaceuticals stacked on top of them, because most of the time it's the drugs that are the problem. It's not the patient, and these drugs make it worse.
Yeah.
And conventional medicine just doesn't get that.
Do you have to work with conventional medicine doctors, or do you kind of work around them? Obviously, it's a delicate balance you have to, right? Because they've, if somebody, say, has stage 4 cancer, they're working with oncologists. I can see that some of those oncologists might be, poo-pooing cannabis, and it makes people more anxious. This happened with my dad. He was suffering from cancer, and the oncologist was telling him one thing, and then people in his family that were kind of more naturopathically oriented were telling him another, and it was stressing him out a bit. So how do you kind of navigate that with people who are hearing one thing from their doctor and hearing maybe another thing from you?
Well, the doctors are curious, but they're really not willing to step their toes into this until it's descheduled and
Yeah.
legalized. When it comes to traditional oncologists, they don't want the patients to use any cannabis. They're really afraid of contraindications and interactions with what they're doing. They don't want anybody to mess with the chemotherapy or the immunotherapy. And when people are taking cannabis with chemotherapy, you might be able to potentiate that and therefore be able to use less of a dose of the chemotherapy because these are toxic poisons. And, the whole goal needs to be accomplishing patient improvement, not just how many milligrams can we get in them. And then when it comes to immunotherapy, a lot of times what we want to do is decrease the number of cannabinoids and milligrams that are going into the body because some of the immunotherapies are inflaming the system, trying to rev up the immune system. And cannabinoids are immunosuppressive. So we want to use them just for symptoms. But you mentioned with your father, and it's like getting more anxious. That, it is through the THC and probably a little too much of a dose. So if you give CBD concurrently with the THC and you really minimize the dose, you can be much more effective with it and not trigger the anxiety. So
Yeah.
what we do in our case-by-case personalized analysis, when somebody works with a nurse one-on-one, they get that kind of handholding.
Yeah. And these nurses, let's explain their training and to people feel confident about who they are. I mean, I would feel confident with you, but we can't always get you. So who are the nurses and what is their training and background?
Well, all of the nurses have holistic caring and the green nurse are all RNs. So registered nurses. Myself, I've been an RN since 1986. Sherry Tutkus, my VP of nursing, has been an RN since 87 or 88. Jana Champagne for at least the last couple decades. Ruth has been a nurse for 40 years. Terry's been a nurse for 40 years. And then so what we have to do is teach them cannabis. And Heather Shelton, she's been a nurse for a good couple of decades. And these are all oncology, palliative care, hospice nurses that have been very well seasoned as nurses, and we need to teach them cannabis. And so that's what happened when I first started doing this in 2015, 2016. I hung out my shingle. I started to get referrals from a palliative care physician here in San Diego. And as my practice was growing and I was getting more referrals, I needed to hire nurses. So I wrote a training manual for nurses and I advertised through Indeed and got some new nurses to come in and join my shop. And so they went through that training manual and we would do one-on-one training as well. And this is back in the old days, even before Zoom. Right. So we were just meeting at my dining room table and going through it all and teaching them. But that training manual became my book. So I wrote a book called Cannabis for Health, Become a Coach.
Yeah.
And so this book then became the training ground for all of my programs. And when I say programs, I'm talking about full comprehensive programs where I train healthcare professionals. And then another one where I train cannabis industry professionals, people that want to work in the industry and understand this from a medical standpoint. But in the programs, we go through the history of use as a medicine for 5,000 years, the history of prohibition to get them to understand contextually how we lost access to this plant and why, and the corporate interests and racism that fueled that. Then we break into the endocannabinoid system and all of the research of Dr. Meshulam and Israel and the discovery of CBD and THC, and then discovering the receptors, CD1, CD2, and figuring out what they do because we're hardwired for this plant. And, when these compounds get into our body, we light up like a Christmas tree, which then translates over to the pleiotropic effects where cannabis goes into the body and it's multi-effect, multimodal. Like when people are like, is this snake oil or what? Because, cannabis is so good for everything. Well, that's because we are key to respond to these compounds to bring us back into homeostasis and balance out the body. And then after I explain the endocannabinoid system, we go through the cannabinoids and the synthetic, the endocannabinoids and the phytocannabinoids and now terpenes, and then break into the pharmacology. What are the pharmacodynamics? When you take these different routes of administration, how do they play in the body? How do you understand inhalation versus oral ingestion versus sublabel tinctures and patches and suppositories and all of that? And then all of the product training. How do we really put this into clinical practice? And what do we use for each? So that's all module 1. And then module 2 in my healthcare course or the industry course, it's just broken out into an overview, is deep dive conditions with the research on, with epilepsy. Here's all the research that shows how cannabis can work for epilepsy. Here's what conventional medicine does. Here's where that falls short. Here's how we might be able to bring cannabinoids into the treatment plan. starting dosing for the specific cannabinoids and the protocols to introduce that into the body, and then how to make adjustments and monitor care. And I do that for epilepsy, autism, pediatric cancers, adult cancers, geriatrics, dementias, Parkinson's, MS, chronic pain, schedules to wean people off opiates, and then holistic health and all the ways to use cannabinoids as facilitators for health promotion. How do we get people to change their diets to an anti-inflammatory diet and use cannabinoids as an assist, or to get them moving again? Getting somebody out of pain, take that window of time where they've used inhalation and get them to exercise, get them to move. And then you've got a 1-2 punch all the time. I try to really be efficient with what we're trying to do, because what we are trying to get people to do is to heal their body and to kickstart that back to good, however we get it there. Reducing the pharmaceuticals and increasing and titrating up into proper formulations of cannabinoids, and then adding functional medicine on top to really bring them back to a state of wholeness. That's our whole goal. So that's whole module 2. And then module 3 in the healthcare course is all about costs of care, the patient legalities, the provider legalities, how to use it in different healthcare settings, and now all of the scope and standards of practice, as well as advocacy opportunities, all about regulations and licensing, so they understand the industry, and then how to network through it and find their sweet spot, as well as how to really coach, and how coaching is different than medicine. We're not looking at a single molecule pharmaceutical and how we're going to trigger a receptor in the body and be done. No, cannabis is going to hit 1,000 receptors in the body. And how do we maximize the benefits and minimize the harms? And that's what I teach in my courses. So when a holistic care nurse goes through my curriculum, they are extremely well trained and well versed on how to sit down and really be that bridge for that patient between conventional and cannabis care.
Not anybody can just take this course, right? You have to be an RN to take this course, or can anyone?
No, that's the beauty of the healthcare course. I wrote it for all licenses, nursing, medical, but also naturopaths, chiropractors, acupuncturists, folks, holistic health practitioners, massage therapists. Anybody that is working with patients can take the healthcare course. And if maybe a massage therapist doesn't want to go through the whole gamut, the cannabis industry professional, my medium course, really has all of that, but taking out the pharmacology so that it's not so dense. And instead of going through each one of those conditions in depth, I paint it in an overview, and it's less about building a business and more about how do I interact with the industry. And then I have a CBD wellness coach, which is just a basic 101 understanding of the endocannabinoid system, CBD, how it works in the body, the different routes of administration, and adding that to holistic living. So I have 3 different levels of courses. So the CBD wellness coach, the industry professional, and then the healthcare programs.
It's great. You meet people at all different levels of where their experience might be. How many people do you think you've trained over the years? Do you have any idea?
Well, doing live courses, I've trained, I don't know, hundreds. And then in the Holistic Caring Network, which is free, everybody can join the network. Just go to holisticcaring.com, click on the free intro course. That gets you right into the network, and you can interact with us. And it plays in what is like a Facebook platform where there's hosts and moderators and conversations, and we're posting things in there all day, every day about cannabis therapeutics and how it works. And there's a patient portal, because all of the modules I wrote also for patients. So like if you are a cancer patient, you can go to holisticcaring.com, click on the cancer module, buy that course, get a complete recorded lecture, all the slides, all the research that goes back behind that, all the protocols of how to add these, and go to a dispensary and shop and understand how to use all the products, and get yourself a dosing plan with all of the different types of products that are available. So we make this very approachable for anybody, whether you're a patient or a professional, to really start somewhere, and then we'll work with you as you grow, and depending on what you want to learn, to take it to the end zone.
So this is not just available to those in California. You could be sort of anywhere in the world.
Well, yeah. And in fact, Holistic Caring is now partnering with Cannabis, an Australian company, and we're taking our curriculum globally. There's 2 clinics that I'm working with in the UK. There are some Canadians that are helping to develop Mexico. We're going to be doing trainings at Coral Cove in Jamaica, and I'm getting certified for the CME programs to be a continuing professional development provider for Australia for GPs. So we're going to be, Holistic Caring is already global, And I've been doing global telehealth for years. We have patients that will schedule through Zoom and, they're just picking the time zone of the nurse. But I see people in Canada and the UK and Europe and even Beirut, Australia.
Wow. And
so,
that's so much more now, huh? I know that's sort of the future of medicine. I hear a lot of people talking about that. You don't really have to go to the office anymore. You can do this through Zoom. And do you find it's just as effective?
Well, yeah. I mean, it's wonderful because, they can upload their scans and medical finals and things like that. And we can look at them and, really this is education and it's promoting hope. One of the first things I have to do is get them to unlearn the stigma so that they understand this is not just a drug of abuse, and B, to promote hope and to give them some optimism that this could be helped. And when you think about the endocannabinoid system, when you think about, well-made products that can modulate and nourish this system, that is what we need to relay to these patients because, many of them have given up and they just suffer and struggle with these conditions that they don't need to. It's wonderful to be able to work globally and to create these educational systems to meet people and where they are and then to start expanding this into integrative medicine.
Yeah. Well,
where it belongs.
It's just wonderful what you're doing. Elisabeth, thank you so much for joining us today. I know you mentioned the website, but let's mention it again. If people want to find out more about holistic caring, order your book, where should they go?
Yes, holisticcaring.com. And you can email me, Elisabeth with an S at holisticcaring.com or info@holisticcaring.com. And when you get to the website, please do join the network where you can really interact with some of our team and professionals and patients on the course platform and to check out everything that is available because we're just getting started. There's so much more good to come.
Yeah. All right. Well, have a wonderful rest of your day and thank you for talking to us today.
Okay. Well, thank you so much, Jonathan.
Enhance Your Life is brought to you by Wana, the #1 infused product in North America. Wana's entire process is designed to deliver the same great experience time after time. They have spent years fine-tuning their recipes so that their products are delicious, consistent, and potent. For more information, head on over to wanabrands.com. That's Wana, W-A-N-A, brands.com.